Hello and welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Dr. Tom Sugarman. He's joining us here from Sutter Delta Medical Center in California and Senior Director of Government Affairs at Vituity, joining us to talk about how critical it is for hospitals and health systems to start preparing now prior to the onset of the potential COVID-19 surge. Welcome to Health Professional Radio, Dr. Tom Sugarman.
Thank you very much. Thank you for having me.
Now, of course, I did mention that you're joining us from Sutter Delta Medical Center in California. What is your role there? And let's talk about COVID-19 and how it's going to impact this flu season.
Okay. Well, at Sutter Delta, I'm a practicing emergency physician. I also chair the Performance Improvement Committee at the hospital, and I'm one of the assistant medical directors for the emergency department.
As flu season approaches, a lot of people are concerned about getting the flu shot, some of the symptoms that some people believe that the flu shot causes, and with all of the controversy surrounding the symptoms mimicking COVID-19.
Well, I think it's important that everybody who doesn't have a medical contraindication does get a flu vaccine this year to prevent influenza. In general, influenza is a mild disease for most people, but occasionally people get quite sick from it. Mm-hmm. And we know that we can prevent a lot of influenza by people getting vaccinated. In terms of confusing the symptoms or the side effects after a flu vaccine with COVID, that's a possibility, but not very likely to happen. Generally, most people who get an influenza vaccine have very few, if any, side effects. In fact, I just had mine 2 days ago, and other than a slightly sore arm from where the injection was, no big deal. But you don't typically get a fever, you don't typically get a cough, you don't lose your sense of taste. All those are typical signs of COVID. And so I wouldn't expect to see those after a vaccination.
As many children are going back to school in virtual or a hybrid learning situation, a lot of states are rolling back COVID-19 restrictions, even though we hear about the cases trending upward. Yes,
it's a very difficult balance, mitigating the spread and the risk of COVID-19 versus mitigating the side effects or the adverse consequences from shelter in place or kids not going to school or social isolation. I think that there are ways to increase our activity, but they have to be done really safely, and that involves everybody being vaccinated for influenza. That involves really any sign of symptoms that you immediately isolate or quarantine yourself at home depending upon the situation. And it also involves having ready access to testing. But most importantly, people have to be really, really good about wearing a mask whenever they're around other people and being really, really diligent about washing their hands.
Now, as far as the flu and COVID-19, if someone takes a flu shot, that's not going to prevent COVID-19. Let's be clear about that.
That's absolutely correct, Neil. The influenza virus is completely different than SARS-CoV-2, the virus that causes COVID. Now, the symptoms of influenza and COVID can overlap, which is why part of the reason we're so concerned about an influenza outbreak is that we won't be able to tell whether or not you have influenza, COVID, another cold, or maybe all three. And so the more people who come into the hospital or go to see their doctor or try to go to school or whatever they might do with cold-like symptoms or influenza-like symptoms, the more we're likely to be concerned about COVID and the more risk we have of spreading COVID if people go about their normal activities when they're ill.
When a person tries to alleviate some of the symptoms with over-the-counter medications, if a person has COVID-19 and they're taking medications for the flu, whether that be over-the-counter or actually medications from a doctor for the flu, will that compound the COVID-19?
Well, if one were to have both diseases at once, then there's an increased chance that you're going to have a more severe pneumonia or complications. But in terms of the typical over-the-counter medications people use for influenza or COVID, they would be the same, and I think that I wouldn't be concerned about the over-the-counter medications making either disease worse, as long as you take them according to the recommended directions. The one concern I would have is that if you're febrile and you take acetaminophen, Tylenol, or ibuprofen, sometimes called Advil, and that gets rid of your fever, that doesn't mean that you don't have a virus, and that doesn't mean you're not contagious. Mm-hmm. A fever that's treated by an over-the-counter anti-fever medicine is still a fever, and you still need to be at home, staying away from other people.
What do you think about the situation where you go to the hospital? If once the symptoms are bad enough for you to seek medical care at a hospital, is it a pretty good chance that you're going to be admitted and not be able to go back home no matter what your age?
No, I would say that in the emergency department I work in, and from speaking to my colleagues across the country, the vast majority of people who come to the emergency department with an influenza-like illness, or in this case a COVID-like illness, do not need to be admitted. They can go home. So what we try to do is we try to assess them to determine what their oxygenation is, how well they're breathing, and any other complications. And then if we don't have to hospitalize them, we'll send them on home with very careful instructions about what to look for in case they're getting worse. And oftentimes we'll arrange for very prompt follow-up, sometimes by telehealth, to really watch them closely and see how they're doing. But our goal would be to try to send them on home if it's possible.
Now, our healthcare experts are telling us that we should expect a surge, especially this winter. They're telling us that going back to school is kind of an iffy thing. Are you seeing healthcare facilities amassing extra equipment? Is that something that most hospitals and facilities should be doing right now in preparation for the coming months?
I think most of the hospitals have got the equipment in place at this point for a surge. I agree with you. I do think there'll be some surges, and there's already seeing some surges in some states right now. I think that'll worsen as people get about more activities as the holidays come, as more kids go to school, as college students return from college. I think one thing that I'm concerned that some hospitals and healthcare institutions haven't done enough of is to evaluate what their staffing needs are going to be in case they get a massive surge. It's not just a question of having enough people who know how to do nursing or know how to do doctoring or other important critical roles in the hospital, but they have to actually have the right expertise to take care of this type of patient. And we found that in many situations during the surges, hospitals don't have good plans in place for bringing in outside workers to help supplement their native workforce who are either overwhelmed because they're too busy or frankly are getting sick themselves and then they can't work.
Have you seen a good relationship between healthcare systems that aren't necessarily in the same jurisdiction or the same community helping with staff, or is that something that people are trying to hold on to staff for dear life?
I think it's a combination of both those things, but mostly the former, where people are really trying to help each other out. So, for example, at the end of April, myself and eventually about 55 of the people from my group went to help and provide relief work in New York City over a period of several months. We each went for 2 to 4 weeks at a time. And that came about because the governor of California wanted to provide California doctors to New York and also to gain some learning and some knowledge from our experience in New York. And so at that point, California didn't have a huge number of COVID cases, and so we had extra personnel, and we could safely send them to New York to really relieve an overburdened healthcare system at that point.
Do you see some of these restrictions being tightened going forward, or should we start loosening them as a vaccine is developed, hopefully in the next several months?
You mean the restrictions on activities?
As far as activities, especially where school is concerned, that seems to be, forefront in people's mind with both the flu and COVID-19. We're talking about children, and they get sick anyway. But when you've got both of these looming over their heads as well, there's lots of fear.
As I said, there's a very serious and real concern that children will become vectors and spread this disease because about 40% of people who get COVID-19 don't have any symptoms. So they don't even know that they're sick, yet they're spreading the disease. And that will increase as children go back to school for sure. I think that we need to be following the health experts' guidelines. Dr. Fauci, others at the CDC and NIH, in particular, having robust testing, people being very, very responsible of quarantining themselves at home if they've been exposed or isolating themselves at home if they have any illness, and then wearing masks. And those things, I think, can mitigate the risk. That said, in a community where you're having an explosion or a surge, that's probably not the community that should be going back to school. But in a community where the numbers are well controlled, if you follow the safety precautions, I think that you can do it relatively safely as long as you're monitoring for a pickup in the cases and then can kind of either stop the school or isolate that classroom or quarantine that classroom, depending upon whether people are sick or exposed.
Well, we'd like to learn some more about your company, Vituity. Where can our listeners get some more information online?
You could go to our website, which is Vituity, V as in Victor, ITUITY, healthprofessionalradio.com.
Well, Dr. Sugarman, I appreciate you joining us here on Health Professional Radio.
Thank you very much. It was a pleasure being here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tom Sugarman. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.